Hi, and welcome to Attentive Healthcare Solutions webinar, NextGen Document Management 101, How-Tos, Tips, and Tricks. My name is Chelsea Grover, and I'm the Marketing Communications Manager for Attentive. Before we dive into today's webinar, I'd like to take a moment to explain the process for today's presentation. First, I'd like to mention this webinar will be recorded, and don't worry, we'll send out a copy of the slides along with the recording within the next week. Next, for those of you who aren't familiar with Attentive, I wanted to share a bit of who we are with you. We specialize specifically in next-gen healthcare, and we're passionate about providing solutions for healthcare provider partners, which in turn help them to improve patient care, enhance the patient experience, and maintain a financially healthy practice. To sum it up, we basically do everything next-gen. We also have some next-gen add-on productivity solutions, including ChartGuard, Refund Manager, Unapplied and Deposit Manager, and Multiple Encounter Billing Manager. If you'd like further information on what we do, please drop us a note in the questions area. Next, this is usually when I tell you the date of our next upcoming webinar, except this time it's a bit of a secret because it's going to be on the NextGen Spring Release 6.2021.1 upgrade. In it, you can depend on us to do our usual favorite features kind of a webinar, but we can't give you the exact date yet due to the secrecy around the release date. So keep your eyes out for it, and we'll send out an invitation to the webinar about a week before the webinar. We hope to see you there. So back to today's presentation on NextGen Document Management 101. At the end of the presentation, we'll open the floor up to questions from you. We'll answer all the questions at the end, but you can type them in the questions area of the webinar control panel whenever they occur to you. And finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. And again, questions may be entered in the questions box. So without further delay, I'd like to introduce our presenter for today. Lexi DeMarsh is Manager of Consultant Development at Attentive, and thus is in a wonderful position to take you through this powerful feature. So Lexi, take it away when you're ready.
All right, thank you, Chelsea. And thank you everyone for joining us today as we review the ins and outs of the NextGen Document Management application. So I'm hoping by the end of today's webinar, you'll have kind of a better understanding of how to configure and then also use this application. So, as we know in our electronic world, we really strive to eliminate paper, but there are just some instances where it's just necessary. Maybe it's receiving back a signed consent form, or a patient comes in and brings printed records from another provider. So in order to efficiently get that information into your system, you need to do it in a way that makes that information accessible to those providing your patient's care. So really that's the ultimate goal. So let's jump right in with some ways to make that easier in your practice. So I'd like to begin kind of at square one by reviewing the document management configuration. So for those of you who have maybe been using document management for a while, you may already have a lot of these items already configured, but it might be worthwhile to kind of review that setup, see if it's really meeting your practice's needs, or maybe you're expanding and so you have the need to modify that configuration. So let's begin by looking at the first piece of configuration. So like all of our applications in NextGen, there are several security rights that apply to the document management application. So all of these rights can be found underneath the operations section in that imaging group of rights. So these imaging rights, they can allow you to really have control over individual users' ability to do things like scan a document or image, the ability to file it, and also to make any modifications. So there are also options under these rights for things like accessing secured image batches. So the ability to do that would allow the user to access a batch that another user has created. So, an example for turning that right on would be maybe of a user who's in a management role, and they need to have oversight of the batches of other users so they can really see what's being scanned and filed. So we'll be mentioning some of these other rights kind of as we go along that are available as we go through the different functions of the application. So once you've configured those rights for all of your users that are going to be using this document management application, your next step would be to configure several master files, and we'll find these in file maintenance. So the order in which these master files are configured is important. So the reason for this is that there are pieces configured in one master file that are going to be used in the next. So the order that we have them listed here on the screen is the order that NextGen recommends you configure these master files. So the main master files that need to be configured for document management are the ones we see here, so our storage locations. Then the next would be our document fields, followed by document field types, our view categories. Then next would be our enterprise preferences, followed by some additional practice preferences. So optionally, there are a few other master files and preferences that can be set depending on the features that you're going to be using. So for example, our quick file hotkeys, then you would configure quick file configurations. There are also some barcode scanning configuration that can be done if your practice chooses to use that feature. And then finally, some user preferences. So each user can set up some preferences for the application as well. So again, you would configure these in the order that we see listed here on the screen. So now let's jump in and take a look at some of the steps that would be involved in this configuration. So the first step in the configuration or even reconfiguration, if your practice is changing and maybe you need to modify the storage locations, would be the storage location master file. So our storage locations, if you aren't familiar with these, they are created to kind of direct your system to a specific folder. So that folder is used to either temporarily or permanently hold any scanned items that are coming from document management. So in a typical configuration, there are usually several storage locations needed. So you would create them here in this master file. And then, as we'll see in a little bit later on in the slides, we'll actually apply those in practice preferences. The next step in the configuration is the creation of what we call our document fields. So our document fields, they provide us with various pieces of data that's collected during that filing process in document management. So these fields are going to contain information, so things like the patient's name, date of birth, the test date, of a certain result, or even the rendering provider that's responsible for the contents of that document. To further classify these pieces of data, there are also three categories of document fields. So the first is what we call a system field. So a system field is going to use person-specific information. So what I mean by that is something like a first name or a last name. Then our second type of document field is technically a subset of our system fields. Those are our key fields. So that, like I said, is a type of system field, and that is going to serve as a unique identifier. So that's going to help us with locating patient information while we're filing. So some examples of that key field is things like the encounter number, the medical record number, and the person number. So NextGen does recommend that out of those options that you use the person number as that unique identifier. So for instance, if I add that person number, as part of that filing process, the system can actually use that person number to locate other pieces of information that we classify under that system field. And then finally, our last type are user-defined fields. So these fields, they're not linked to any patient demographic information. They're really just used to further classify documents however your practice can use them. So for example, the user-defined fields, they can really have any description that your practice needs to display during filing. So things like a date, like maybe you want to see what the test date was on a result, or maybe the date of service. We can also set up user-defined fields for things like the rendering provider. Like you can see in this example, we have a user-defined field of rendering provider with a description for PAQ provider. So again, as a practice, it just kind of helps to further define what we're asking the person who's filing to enter here. So once we've created those document fields that are needed for your practice, your next step would be to then group those fields together into what we call document types. So our document types are assigned to image during scanning. So this helps to classify that document, as well as it gives the user the necessary prompts to enter the detail that's needed for filing that document. So we have several options that we can use when we're creating our document types. So one of the first options is to select a document type template. So our document type templates, they can be used to default which fields are added for this particular document type. So this can be a really great starting point. Maybe if you're creating a new document type and you're not sure exactly which fields to include, but this is just a starting point. You can further customize that document type as needed. So some of our options under those templates are things like NextGen EOB for explanation benefits, fee tickets, as well as patient documents. Another option can come into play. The document type is going to be used for scanned items that need to go to the PAQ, or that provider approval queue. So you can check off the box for signature required, and then that's just going to ensure that a provider is selected during that filing process, so those items will then go to the PAQ. Another option that we have on the screen is to select our checkbox for duplicate check. So checking that box will actually allow NextGen to prompt a user during scanning if it appears that what they're scanning looks like it's a duplicate document. So it's an alert that pops up, but it won't stop the user from continuing to scan and file this document. But it does kind of give them a chance to maybe stop and verify that document doesn't already exist in NextGen. So I did want to point out that in order to use this feature, that there's also actually a practice preference that needs to be turned on. So after we have selected those document fields that we want to include, we have a few columns that will allow us to kind of customize how these fields are going to be used during the filing process. So the first column is our auto search feature. So auto search is going to allow for patient information to default based on the selected field. So as you can see, like in this screenshot, we have selected person number as our auto search field. So when I enter the person number, the system is actually going to be able to autofill other fields that we have selected here. For example, things like the first name, last name, social security number, date of birth, things like that. So this option can only be turned on for our key fields. So if you remember from a few slides, that key fields are those unique identifiers. So again, things like that person number, medical record number, things like that. Another option that we have here is to mark a field as required. So this is going to ensure that when whoever's filing this document, that they're capturing that information. So important details don't get missed. The next column is an important one. That is to make sure that this field is visible. So checking off that visible column will allow the information that populates in that field to be visible on that filing window in the application. The next column for our field type, this really is just informational only. So you can't modify this. This is just to let you know whether a particular field that you've selected is a system, key, or user-defined field. So one of the ways that this can come in handy is if you are selecting from that auto search, it lets you know quickly which options you have, for example, for those key fields. And then the final column here is to allow the data that we see in this field to show in the EHR and the PM applications. So for example, maybe you've scanned in a test result. It might be helpful to be able to see quickly, in the EHR on that categories tab, what the test date was. So you can choose which of those items can display in the EHR and PM applications. So after all of our document fields have been organized into those document types, our final step is going to be to assign the document types to our view categories. So our view categories are going to allow for grouping of our various document types. So one place that you probably are familiar with seeing these view categories is in the EHR application. So we have that categories tab of the history toolbar. So in these categories, you basically would group together document types that are similar, as well as you have the option to add other items such as EHR templates, documents that have been generated in the EHR, things like that. Something to note, if you do create a new document type and you don't assign it to any category, it will display as uncategorized. So users will still be able to see it. It just won't have an assigned category to belong to. But if you do choose to change that in the future, or you modify any of these view categories, you do have an option when you're modifying them to update existing patient history. So if you did want to retroactively go back and basically move those previously scanned documents into your new categories or your new arrangement, you can do that. So those were kind of the basic settings that are usually added by all practices. These next settings are kind of optional features just to kind of make filing a little easier. So one of those optional features is our quick file configurations. So there's two quick file master files. The first one we would start with is what we call our quick file hotkeys. So our quick file hotkeys, they can be used to save time when users are filing images by allowing defaulting of certain document fields. So these hotkeys are set up by document type. So like for example here, we have a document type of lab results. We've specified it that these are lab results for Dr. Barclay. And then we've gone ahead and defaulted that test date as today's date, and then the PAQ provider as Dr. Joseph Barclay. So basically what this is going to do is if a user were to file and use this hotkey, they are going to automatically have today's date selected as well as our provider. So it just saves them a little bit of time when filing. So once you've configured all of the necessary hotkeys that you need, you can then group those together in what we call our quick file configurations. So basically these configurations are just used, like I said, to group together those hotkeys, and then they determine which hotkeys the users will have available. So we'll see when we get to our user preferences how we can actually assign these hotkeys. So at the enterprise level, there are several preferences that can be configured. So one of these preferences can help to limit the impact, that kind of like a broad search if a user doesn't add a lot of search criteria in document management, kind of limit that impact it has on your system. So this option for the maximum number of search results, this can be set anywhere from 100 to 3,000 results. And so it just kind of depends on your organization's needs. Another option that you can set here in Enterprise Preferences is to enable using categories in search results. So this can just kind of help to further group those search results in document management to help users find the scanned image that they're looking for. We also have a checkbox to compress color images. So this can help to reduce the impact if your practice is scanning images in color. So that can really bog down your system's memory, as they can be kind of large files. So you can set here to compress those color images, just keeping in mind that it will reduce the image quality somewhat. So it's kind of the decision you have to make. And if this setting is turned on after your practice has already started using document management, just to know it will only affect images going forward. There's also a preference if your organization is licensed and configured to use remote scanning. You'll want to make sure that you check off that Enable Remote Scanning checkbox. Finally, there's also an option in our enterprise preferences to add a disclaimer to document management images that are printed. So this is text that your practice can determine whatever this disclaimer says. Like for example, maybe you want to add some text that talks about the confidentiality of this scanned item, whatever it may be. So you can set up those options here in your enterprise preferences. So in addition to those enterprise preferences that we just looked at, there are also several settings at the practice level. So all of these preferences can be found on our imaging tab in practice preferences. So the first preference here is a really important piece of configuration, and that is setting up your imaging locations. So this is where your practice can apply those images paths. If you remember, we talked about setting those up in our storage locations master file. So there are actually three options for the storage paths. The first is the archive path. So the archive path, this is a permanent storage location for any of those document and images that are scanned into document management. The second path is what we call our cache path. So the cache path is used to temporarily save copies of those images to help with faster retrieval. And then the final path is the hard delete path. So this is optional, but this does allow storage of items that have been deleted from the document management application. So if users have the right to delete items, they would come and be saved in this folder that you've designated as your hard delete folder. Basically what that does is it's going to remove that image or page or whatever it may be from document management, but it saves them in this folder, so that way you can still have some oversight. For example, if you're like a manager or supervisor, you could go in and you can actually review those items before they're permanently reviewed from the system. So NextGen does actually recommend that there are separate paths for that archive and that cache path. So they recommend they're in different locations, different folders on your network. But as you can see in this example, they can be the same if that works for your practice setup. So another practice preference that practices can turn on is the ability to delete refiled PAQ entries. So as long as that item that's being refiled, you're using a new document type that doesn't require a signature. And the other caveat is that the PAQ item can't already been accepted or rejected by the provider. So as long as those two conditions are met, then it will allow that item as it's refiled to actually be removed from the PAQ if it was sent there by accident. The other option here in practice preferences is to send our annotations to the patient portal. So our annotations can be things added to an image. So things like text, if you add circles or boxes or even drawings. You can choose this option if you would like that additional information that's added to be visible to the patient. And then there's also a practice preference that I mentioned on a previous slide, and that is to check for duplicate documents. So as I mentioned, this is a preference that if it's selected, as well as that duplicate check is enabled for your document types, then the system will alert the user when it appears that an item has already been scanned for that particular patient. So you would turn it on here at the practice level, and then you would also want to turn it on for your individual document types as well. So individual users also have the ability to set their own preferences in document management. So this would take place in the application in the admin menu. So the first three options that users would have allow for defaulting some certain information when they're filing. So the first is to default a quick file configuration. So if a user wants to use that quick file feature, it's important that they select at least one configuration here under user preferences, because that's going to actually activate the feature so the user has that ability. I did want to point out that it's just a default to see which item you see first on the list. So whichever configuration they select here, it doesn't limit their ability to use if you have more than one configuration set up at the practice level. Our next option is to default our document type. So the selected document type in this feature would allow that to be chosen automatically when the user is in the filing window. Again, doesn't limit their options, just saves them some time, maybe their most commonly used document type. Users also have the ability to default a rendering provider. So again, default that rendering provider to save time, if they're selecting documents for something like, items to go to the PAQ, or if you're documenting things like who the ordering provider was for a certain result. There are also several options at the user level for how the images will be viewed in that document management application. So the first is for any text that's added to a document using those annotation tools, the user can choose the text font as well as the color. So they can modify this to kind of make it more visible and easier for them to see on an image. Kind of along the same line, the user can also default the signature font as well as the color. So if a user is going to be adding their signature in document management, and they can choose that font and color to make it more visible on that image. And then finally, there's also an option for how many images a user can see at one time when they're in the document management application. So checking off this preference for open images in New Viewer is going to allow the user to see multiple images at once, and they can see up to 6 in one screen. So a step in adding our new document types or security groups that frequently gets forgotten is adding rights for users to actually be able to view and print those documents that are filed under the different document types. So these rights are assigned based on the security groups that you have set up in System Administrator. So the security rights for our document types, they can be added in a few places. So first is in our document types master file. So if we're actually in there, maybe adding a new document type or making modifications, there is a security button in that master file that allows you to add those rights. The other option is from directly within the document management application. If we go to that admin menu, there is a security option there as well. So, typically a lot of times, I have users who've added a new document type and nobody in the system or maybe certain groups aren't able to see these documents, in the EHR or practice management. So my first step in always troubleshooting is check those document type securities and make sure that you have, set those up correctly. So then our final piece that practices could configure, depending on if you want to use this feature, is barcode scanning. So barcodes can be used in NextGen, and it's going to kind of help simplify as well as automate that filing process. So there are 2 options that a practice can use if they choose to utilize barcodes in document management. So the first is scanning using barcode separator sheets. So these are barcode separator sheets that are printed ahead of time, and then they can be inserted into documents before scanning. So that's going to allow to help identify things like document types as well as patient data. So for example, you could include something like the medical record number in your separator sheet to help identify the patient that this document is associated with. The other option is scanning with barcode labels. So these labels can actually be added directly to your existing forms in NextGen, or they could also be printed on our actual sticky labels and then added to a page or a document before scanning. And again, these can help with identifying the particular document type as well as the patient data. So one thing to note is that a practice could choose to use both options, and that's fine. But you'd never want to include barcode separator sheets and our barcode labels in the same batch. So you would just need to use those separately. So to create a barcode separator sheet to be used in the scanning process, you would set that up as a form in our forms master file. So once you have gone ahead into that master file and open a new form, you would select that insert data field, and then you would add the necessary fields for that barcode. So for our barcode separator sheets, NextGen does recommend certain data fields. So for instance, under the system information category, they recommend the system master file text. For patient information, they recommend the patient medical record number as well as the person number. And then under encounter information, they recommend that encounter number. So you can add additional items here as needed, but that's kind of the recommendation. And then once you've created these barcode separator sheets, these would be printed in the practice management application. So you could print these wherever you currently print forms, for example, from the encounter or from, an appointment or your print forms menu. You would be able to print these out and then include them in your documents to be scanned. If your practice would like to add pre-printed barcodes to any of your existing forms, maybe for example, to add a barcode to a patient intake form or a consent form, you would also use this forms master file. So you would open up, that existing form, select that insert data field option again, and then NextGen also has recommended data fields for our pre-printed barcodes. So for example, under the patient information section, you would add the patient medical record number as well as the person number, and then under encounter information, that encounter number. So then you could print this form like we saw with our barcode separator sheets. From your normal workflow, you would just print that form and then that barcode would be added to it. So once a practice has configured, if you do plan to use those barcode separator sheets or the labels, there are two final steps to allow the users who are going to be scanning with barcodes to do so. So the first is to apply a user level license. So this does require a separate license for barcode scanning. So that would be applied in our user profile and system administrator, just like any of our other licenses. The last step then would be to enable barcode recognition. And this takes place in the user preferences for document management. So you do need to turn that on for each user, again, that would be using the barcodes. So after you've completed all of that configuration, then you be ready to go to use barcodes, and again, I can just kind of simplify that scanning process. So once we've completed all of those necessary and optional configurations, your practice is ready to go. So you could start scanning your documents and images, as well as filing them into the patient charts. So now let's take a look at some of the ways that this can be done and some of the tips and tricks that we've learned along the years. So documents and images that are scanned into NextGen, they can be acquired using kind of two main options. So the first is batches. So these can allow for scanning and importing multiple documents or images at one time for multiple patients. So for example, batches can be used maybe if you gather all of your signed consent forms and you plan on scanning and filing them at the end of the day. We also have another option called scan and file. So this allows us to, again, scan or import for one document type. It's typically for one patient as well. So, for example, maybe we have a patient that brings outside records in, and those need to be scanned. At that time, you can use scan and file. So there are several methods, whether we're doing batches or scan and file, to actually select the items that are going to be then filed into NextGen. So the first is probably what we most often think of when we think of using document management, and that is actually using a scanner. So this would be using what's called a Twain compliant scanner. That's connected to the computer to scan those items directly into NextGen. There are two other options that can be used. The next one is file import. So file import actually allows you to select either documents or images, and those can come from a folder either located directly on the computer or even in a network file. And then our third option is our directory import. So again, this is pulling from a folder either physically on the computer or in a network. The difference with our directory import here is that we're pulling all contents of that directory folder. So for example, maybe things are being scanned periodically, maybe throughout the day, and then a user goes to file everything in that folder at one time. They could use a directory import. So to import items for one document type, as I mentioned, the recommended method would be to use our scan and file icon. So once we've selected that scan and file icon, we'll see on this batch information window that the batch description does default just to quick scan. Again, this is typically used to just be one document type, one patient. You're kind of just scanning that in, going to file it. So you don't necessarily need to name the batch because it won't stick around after you're done filing, but you do have the ability to rename that if you'd like to. Once you've selected that batch description, if it's needed, you can choose your method to import your items. So under that image acquisition section, you would choose your acquire profile. So again, whether you're going to use a scanner or import the file somehow. And then you would click acquire. So as we mentioned, our other option is to actually create those batches. So that's going to be typically for multiple documents, multiple patients. So we would create a batch by clicking our batches icon in the document management application. On this batch information window, we would, after we've selected new to create our batch, we could enter a batch description. So again, typically batches are created and they may be added to over time. So it might be more important here to add a batch description to help identify what's located in that image batch. Next, we choose our acquire profile, again under that image acquisition section. Again, we have our same options here with batches, so things like using a scanner or importing files as well. And then once we've selected that, we will click acquire to actually bring those items into NextGen. So our batches can be modified after they've been created. So a few options. The first is to add more pages to the same document. So, for example, maybe you scanned a document and you realize that a page got left out and now you need to add it to that existing document. So we would click our batches icon in document management. We would find that batch in our images batch window. And then we would open that window, and on that batch information window, we could click acquire again. So then that is going to add whatever we're scanning in to that same document. The other option is we need to add more documents to the same batch. So maybe it is a similar, for this example, we're scanning hospital records. So now we have another grouping of hospital records, but this needs to be a separate document type. It's for a different patient. So again, we click that batches icon to open up that existing batch. And then on this batch information window, instead of clicking acquire, now we click next doc. So again, that's pulling those pages as a separate document type into our existing batch. So once we have gone ahead and pulled in those items that need to come into NextGen, our next step is going to be to file those images. So filing our images is basically applying all of our document fields that we need to. So for example, things like the document type, so to kind of categorize that item. We can also select our patient here. So to do that, we would click that menu button to the right of our document type field, and we could select our patient. Based on the patient we select, we can default some of our patient-defined fields. So if you remember that auto search feature that we mentioned, so for example, things like the person number, the name, date of birth, things like that can autofill based on the patient that we selected. Then the user would want to complete any other required fields, so those will be listed in red. Again, if you remember in our document type setup, we could determine which fields are required. So for example, here for my CT scan, I need to select the test date. Once we've selected all of the items that need to be required for filing, we would click our File button. So if you are filing a batch that is multiple documents, you don't actually have to click the File button after each page. To save some time, you can use in your image viewer, there's blue arrows to allow you to go sort through the pages of your document. So you could actually go to the first page of what would be the next document, and then on our filing window, you would click New Doc. So then that is going to tell NextGen that this is where our new document starts, and then we can go up and we can select our filing information again. So again, that document type, patient information, and all of our required fields. So if your practice has configured that quick file feature, so those hotkeys and those configurations, these can be used in that filing menu. And again, this is going to allow the user to default certain fields based on the document type. So as a reminder, these quick file options do need to first be created in file maintenance. And then that configuration has to be selected as a user preference. So once those two items have been completed, a user can apply a quick file hotkey. So you can see here in our filing window on the right-hand side, we would select our quick file configuration, and then we would choose from the list of hotkeys available. So if, in this example, I'm filing, CT scan, I can just click on the right-hand side where it says CT scan. It's going to default that information that I told it to default, and then I could continue with my filing process as normal. So once our images have been filed, our final step would be to actually post those images. So posting the images allows them to be visible in applications outside of document management. So this kind of allows for any changes to be made to those filing details before users are actually able to see those document and images, like in the EHR or the PM application. So to post a document using scan and file, you would file all of the pages in the document, and then you'll be presented with a prompt that says, would you like to post this document? And you can say yes. If you're working with batches, you can open up that image batch window and right-click on the batch and select Post. So posting our image, not only does it make it available to other applications to see those items, it also will lock down that image. So that way changes can only be made by users who have rights to refile an item in document management. So that can just kind of help lock down the users who have the ability to make those changes once they've been posted. So then once we have filed those items in document management and they've been posted, we can recall those images, view them, make modifications, whatever we need to do, by clicking our search icon. So you can search for an image using any kind of patient demographic details, the patient's name, date of birth. But you also have the option to use what's called the image search criteria. And that kind of just help to locate specific documents. So searching by things like the image category, document type, or even the document number if you have that. Users can also narrow down that search even further by clicking the Advanced button. And that's going to give the users some more options. Like for example, they can search by things like who scanned an item, or who was filed by or when. And then if a user chooses a document type before clicking that advanced button, they're going to get even more specific search criteria. Like for example, I chose a document type of consults, so now it's allowing me to search by the date of surgery. So it can just allow the user to kind of narrow down the results even further. So when we're working with our filed images, we can use what we call our image viewer toolbar to give us some additional options for things like how we view the image, as well as making changes. So for example, like we can change the view of the image by using our buttons to rotate the image, zoom in and out. We can even change contrast, if it's hard to see. We can select our annotation button to give the user the ability to do things like add text, circles, boxes, draw on the image. We can create tasks. We can print a specific image or even all images in the batch. We can refile a document if we need to make any changes, add a note to the document as a whole or even an individual page. We can append pages to the document, as well as if we have the rights, delete the current page. So let's take a look at some of these features that are possible using this toolbar. So once our images have been filed, if we need to make any changes, so for example, the patient associated with the image or any of the information under our document fields, we can make those changes by selecting our Refile button in the image viewer. So if the user has rights, like I mentioned, they can then make changes to the patient and any of the other fields filled out, and then they can click File to save those changes. We also have the ability after posting our images to add pages to a document. So to do this, we would click our Append Pages button in that toolbar. And then that's going to open up our batch information window where we could click Acquire and then add pages to that document. So a user may also find that after a document has been filed, certain pages need to be moved around. So this can be either within the same document or even they need to be moved to another document entirely. So, let's say, for example, during scanning, a document's pages got out of order. So after they've been filed, the user sees this and they need to reorder those pages in the document. So the user can either click the Move Page to Number button on our image toolbar, or they can also right-click and select Move Page to. That's going to then allow the user to pick where in the document that page should be. Another example may be after reviewing the document, you find out that there are pages that got into this document and were filed that belong to a different document altogether, maybe a different document type or even a different patient. So this can be easily fixed by just right-clicking on the page that needs to be moved in the first document and selecting Copy Page. Then you would open up the document where these images should actually belong, and you'd right-click on that new document and then click Paste. So it's as simple as just copy and paste to be able to move between documents. So another possibility, once documents have been posted, is maybe there was a page that shouldn't have been scanned in at all. Like for example, maybe it was a cover page of a fax document. So that was accidentally included and it doesn't need to be in NextGen. So to correct this error, if you have the proper rights, you would use a feature that always reminds me of Peter Pan. It's called our Lost Page Batch. So our Lost Page Batch, what it does, it allows for moving of pages out of the document where they don't belong. So first step would be to create that Lost Page Batch. So user would select that batches icon, create the new batch, and then they would right-click on that batch and select Set as Lost Page Batch. So the user could do that and then continue to use this batch as long as they need. If they're in a document where they find, like an example of that cover page that needs to be deleted altogether, they could open that document using that search icon. And then on the page that needs to be removed, they would click in the toolbar or move page to lost page batch. This is then going to move that page to that lost page batch we've created. And then if a user has the proper rights, they can go in, they can review what's in that lost page batch. If everything does in fact need to be deleted, they could delete the batch altogether. So after our users have gone through all of those steps to acquire, file, and then finally post those images in document management, they're available to be retrieved where we'd actually need them most in our EHR and our PM applications. So to view items that have been scanned in to the system in the EHR, you would go into the History toolbar and select our Categories tab. So our items here are organized by those view categories that we set up in File Maintenance, just to kind of help users find what they're looking for. Something that I find is if a user is selecting an image, like for example, that scanned lab result here in Categories, and it's opening up the document management application, so it's taking them out instead of just displaying the item, keeping them within the EHR. There is actually a user preference in the EHR on that main toolbar tab. So if users don't want to be taken out of the EHR application, so they just want to view it within EHR, they would uncheck the preference there, and then that would allow them to view those images within the EHR application. So in addition to be able to view those scan items in the EHR, there's also another feature of document management, and it can really be beneficial in tracking the statuses of your orders. So, as a practice, if you have results coming in from multiple sources, for example, an interface, but also scanned results and images, it can be really hard to close that order loop. So if that's not closed, then you can't really identify if you do have orders that are still outstanding. So to help with this, there is an option when filing results to be able to link them to existing orders module as well as template orders. So this feature can be used for lab, radiology, and even referral orders. So the linking can take place during the filing process in document management, as well as even in the PAQ. So if a provider is signing off on, for example, a test result, they would have the ability to link it to an order then as well. So there are a few practice preferences that can be configured when it comes to linking orders. So these are all found under our Orders module tab of our practice preferences. So the first is to default the view. So basically just allows your practice to choose between diagnostics and radiology, lab orders, and referrals. So you would just choose the most common order type that you would see and need to scan link items to. Practices also have the option to default the order source that they are most likely to see as well. So for example, our orders more commonly placed in our adaptive content engine or our templates or within the orders module. Practices can also choose what the order status will be. So whether when that order is linked, does it update to completed or result received? Again, these are all just kind of options to help set some defaults, but it doesn't limit the functionality of users when they're actually linking those scanned items. Another important piece of the configuration is to mark any of our document types that will be used for scanning results as potential order result. So checking this box is actually going to allow users to see that link-unlink grid on the filing window. So when a user is searching to look for a scanned result to link that to an order, on our link-unlink grid, they would find the matching order, and then they would click either complete for our template orders or link for our order module orders. That's going to then attach that image as well as update that result status to whatever they've selected in this dropdown. So this is how our linked images would be viewed. So for example, in the orders module, on that order summary tab, we could click that paperclip icon, and then you can see I can view the actual order as well as the image directly in the EHR. So in addition to viewing those scan items in the EHR application, you can also see them in our practice management application as well. So these would be visible in the patient's chart under our clinical history and notes tab in our document management category. So similar feature to linking our scanned items to HR orders. There's also kind of a time-saving feature in the practice management side as well. And that is the ability to link a batch of scanned explanation of benefit images or EOB images to a transaction batch in practice management. So when this is done, a user would have the ability to view that EOB image while they're actually entering or modifying those EOB transactions. So the first step would be to scan those images into document management, and we would assign that document type of EOB. Then our second step in practice management would be to open up that transaction batch, and under that document management image batch section, we would choose the correct batch from the list. So this is how it would look for a patient, or excuse me, a user when they are in their payment window for that particular patient. Down along the bottom, they would have a separate window that would actually show the image of that explanation of benefits. So as again, they are adding or modifying those transactions, they're looking directly at the image all in one screen. So hopefully during our webinar today, you kind of picked up on some ideas. Maybe you can apply it at your own practice, either improve that configuration or even just the use of document management. So if as a practice, you can really find a way to make that process of getting those documents and images into your NextGen system more efficient and more organized, you're ultimately going to make that retrieval and use of that information a lot easier on the staff that needs it. So with that, now I'll turn it over to Chelsea.
Okay, awesome. Thank you so much. That was a lot of information, I know, and I know that Lexi's probably exhausted from just going through it for an hour straight. First, to answer the question that I've received from a lot of people, yes, we will be sending out a copy of the slides. We have recorded the whole webinar, so as soon as I get that uploaded and the slides uploaded, I'll send out a link to the slides and the recording. I'd guess that's going to be in a few days here, no longer than a week. So if you don't see those, they might have gone to your spam box, but you can always just shoot us an email and we can send them to you directly as well. So moving into real questions, or more specific questions, I guess. As a reminder, you can enter your questions area in the questions area of the webinar control panel, and we're just going to go through them in the order that we received them. So first question, can you please review the process of how to find a missing or misfiled document? Is there a report, or how would we find an item like this? We had an issue where multiple EKG documents that we cannot find. We think that they are likely filed into one patient, but we don't know if there's a way that we can easily find these.
So one of the options that you could use, maybe if you know for a fact that it was, an EKG document type, for example, is you could use that search criteria and leave the patient information blank, and then, it's like select, for example, that document type of EKG. Maybe use some of those advanced fields to kind of, narrow that down a little bit. That would be my recommendation. The other option is there are some reports that you can use in the practice management application to kind of let you know items that have been scanned. So maybe if you know the user, if it was a particular user that was, filing those would kind of be my two recommendations.
Great, thank you, Lexi. Next question. In the advanced search criteria, can you look at items filed by a specific person on a certain day? For example, all items scanned by John today. I don't see a date field for the filed by.
So yeah, there are certain, I know for just offhand that there is a date field for like scan by. I don't believe that there is an option for file by. Again, kind of going back to those reports, if you do want to see, what has been scanned by a user on a certain day, Those reports do exist in practice management. Otherwise, yeah, you could use some of those advanced criteria, and they do vary based on the document type. So, just depend on the document type that you are searching for.
Okay, thanks. Looks like so far we have 2 more questions to go. So if you have questions, we're gonna keep hanging on and keep answering them. So feel free to ask. Could you mention that you can set up the auto import for inbound eFaxes? It's not a very intuitive product.
So, sorry, what exactly was the question about the process?
Auto import for inbound eFaxes?
So you could definitely, if your eFaxes, one of the ways that I've seen that used is they've set up a specific network folder for their faxes to go to, and then that directory import could be used to pull in all of the faxes from that folder. That's a pretty common way that I've seen used in the past. So that could be one way that you could kind of handle those eFaxes in kind of simpler ways, just to perform that directory import from that network folder.
Great, thank you. Next and possibly last question, is the order linking only available if you use the order module, or can you connect it through order management?
So the order linking feature, it can be used for order module orders, as well as those that come from templates as well. So like our order management template. So yes, you could definitely use it if you don't typically place orders in the orders module. You would just then in those practice preferences, you could default it to look at, again, those templates or that adaptive content engine orders. So yeah, you could definitely use it that way.
Okay, well, it looks like that's all the questions that we have at the moment, but if you think of any other questions, please don't hesitate to reach out to us. You can always reply back directly to one of the emails that I'll be sending, for example, the link to the one with the recording. You can send an email directly to Lexi. Basically, any way that you can get a hold of us, we're happy to help. If you want to learn more about any of our products, such as StartGuard, Refund Manager, Unapplied and Deposit Manager, Multiple Billing Encounter Manager, let us know. We're happy to talk about those as well. And we can always also help with consulting with your practice and helping assess your current readiness, providing recommendations, implementation of new processes and procedures, workflow. We do everything NextGen, like I said in the beginning. So please, any issues that you have or any questions you have, get a hold of us. We're happy to help. And thank you all for joining us today. And have a great week. Happy St. Patrick's Day.
Yes, thank you. Happy St. Patrick's Day.